Okay.
like this. You're amazing.
Oh yeah, I know. I look very dramatic. All right.
Oh my God.
Welcome to the Health Tech Talk Show. Lisa is looking at our party photos right now, in case anyone couldn't tell.
Yeah.
Welcome to our
I'm
Ides of March
multitasking.
edition of the Health Tech Talk Show. Here we are. We're all in recovery from our bender at HIMSS and South by Southwest. Yeah, everybody's got their juices. We're good.
Ay,
Theoretically,
ay,
this
ay.
is on LinkedIn and YouTube right now. I don't know if that's true, but
I'm trying to
I'm not
see.
worried about it. I'm not worried about it. So, I think look, my thing just said happening now, Health Tech Talk Show. Oh, it's working.
What?
That's the YouTube
Ritesh.
one?
Okay. It says
We
it
are
all
getting
works.
better and better. We are
Right?
getting
I'm
better and
so proud
better.
of
Melissa
myself.
has worked really hard. She's worked really hard to get us on YouTube as well. So, we're expanding.
Yeah.
Amazing, amazing work, Melissa.
It's
Thank
because
you.
we pay her so much. She's like a really dedicated,
I just love
well-paid
it here.
well-paid member. Yeah, she just loves it here. So, okay, what are we gonna do? We're gonna do the Lisa Cat news bit. We have our favorite blood relative, Ritesh Patel, our uncle. He's going to be giving us an overview of what happened at South by Southwest. We're very excited to have him. He's basically the most important man alive. And then we're going to end our show with some real talk from Dr. Amy Baxter, who's like a real person who we met at JPM and also a medical doctor, as Lisa likes to say very explicitly. So, all right, Melissa, anything to say before we start talking about business news?
No, just I love it here. Go make sure you follow Health Tech Talk Show on YouTube. More to come later on. That's all. Tip me.
Yeah.
Tip Melissa. Give Melissa a tip. Also, as you know, we just did these amazing live shows, which we had no idea if they would work out, and they partially didn't, but they also totally did. And they're on all of our websites and things, and they were amazing. And a lot of it was Melissa putting up with two like rodeo clowns and like random guests and like random equipment. So like definitely tip Melissa because she worked her butt off.
She totally did. We don't really know how it works to be press, and we miss all of our emails. And Melissa commandeered a large couch area for us in the press room and just basically bullied everyone else who tried
sat
to
there.
come near us.
Just sat there.
Just sat there.
Sat there.
We got yelled at by the press room people. She was like, "Ha!" It was great. All right. Yeah, definitely tip Melissa
Yeah.
because she is the reason we are here. Okay, so Lisa, we got some news. So the first, we got a bunch of
Ay, ay,
news.
ay.
Listen, I have a lot of slides here. So this was a big thing that came out in like the middle of HIMSS that like, oh, we screwed up. We actually don't have that many moms dying as we said we did. Whoops. What do you think?
Incorrect. Absolutely incorrect. Basically, they're like, what's on the death certificate? Like, is it that they directly died while giving birth? And as you may have heard in the United States of America, health-related social needs are very, very bad. And it's really not always possible to draw a direct and immediate line between giving birth and dying because of all kinds of bad, serious obstetrical and other complications. And so these researchers, which I'm not dissing them per se, I'm just saying that they did a full analysis of things like death certificates and vital statistics. They said, well, the direct connection is not as high as we've been saying it is, which is about 36. I think 36 out of, I'm going to make it up, 10,000. That's not true. But they said it was about a third of that.
Yeah.
That's still way higher than in like any other comparable country. And also, like everyone who works in the space is saying, like, hang on there, buddy. In the United States of America, health-related social needs are very bad, and there are lots of reasons and lots of social determinants that drive maternal mortality, and you don't always have the ability to connect it directly to they just gave birth. These things all go together. I don't know. The headlines are a little concerning.
You know what I was thinking about when I read this is like it was saying like, oh yeah, there needs to like you definitely need to die directly because you gave birth, and they were saying like, yeah, all these social determinants and whatever. Like, I don't know, does it not still count that we suck at maternal health if you die because you have severe depression and no support system, and then you like overdose?
Still
Like,
counts.
I don't know. Like, I feel like that still counts a little bit. So I don't know. I mean, we still have, things are still pretty bad. But I do appreciate that they are trying to correct their data collection issues. That's great.
Yeah, so
Congratulations.
just another
Good
shout,
job.
as I do like every single show, shout out to RPH Heroes. One of the metrics they'll be looking at is serious obstetric complications, including adding mental health diagnosis codes to that. So I think we might get some more information on how this is really working through Heroes and through like tons of other programs that are looking at this. People are really taking a careful look at maternal mortality. It just seems like a never
Love
event to me,
it.
but what do I know? What do I know?
Yeah. I don't know, Lisa. I mean, we are just women. I don't know. Moving
Still
on.
got that uterus. It's still there. It's still there.
We do our little lady brains. I don't know. They don't work as hard as everybody else's. But anyway, okay.
No,
So this is real news.
no,
Our friends at Datavant sent us this news. And in full disclosure, we are not real journalists, and we do have biases, and we like our
we are
friends. So
not.
our friends Shannon
Yeah.
West and Segal sent us this thing, and we actually think it's pretty cool. They're giving away patient data, digital access for patients to their data for free. Now they don't have
To
like complete
patients.
records, but that's pretty cool.
They're saying whatever they do have, patients can access it for free, and they really just want to put a stake in the ground and say that no matter what your focus as a business is, that those records that go to patients should go back to them for free in digital form, which is cool. I like it.
Yeah, I mean that's pretty rad. God bless Datavant. Rah rah rah.
Yeah, good job.
Okay. Oh yeah. Now we're coming after United Healthcare for antitrust because Change Healthcare got eaten alive by cyber attack. What do you think about that?
I think lots of things, but in the previous weeks we've talked about Aledade and the connection there. Aledade supports a ton of small-ish and independent providers, and they made a lot of noise. And they also said that they were going to front $100 million to cover the cost of some of these smaller independent practices who were not getting money from Change. Well, their PR game is real strong. You know why? Because I listen to, and you probably do too, the Wall Street Journal podcast. Last night, as I'm driving home, my 1 hour, super long drive late at night, very, very tired, I heard an episode of the Wall Street Journal's podcast, The Cyber Attack That's Roiling Healthcare. And they were following a Christine Meyer, Dr. Meyer, who is the doctor who Aledade were pointing out and saying like she can't save her practice, like we have to front her money. And they didn't mention Aledade. It was very interesting though. They did a great job. Christine Meyer did a good job sort of describing from the provider perspective what it was like to like wake up one day and be like, oh no, we can't bill any like we can't do any billing at all. And she was explaining what it was like to realize that they were entirely dependent on Change Healthcare, which is a problem. And she makes the connection very directly that this is an antitrust problem. As much as she, a simple family doctor with a massive practice, can understand, this seems wrong. And now the United States government agrees. Good job, Aledade PR. They didn't say your name, but they got your doctor in there.
I'll tell you what.
Interesting.
Agree. Also, Aledade did that so late in the game, as we've discussed, that they didn't really have to like do much.
I mean, TBD.
TBD.
What Dr. Meyer was saying is that like they have they say it's going to be fixed on the 18th. They have no idea when they're actually going to get all those old claims paid or when they're going to actually clean up that. So it could take a while. She was saying I think she has a pretty big practice, two locations in, I want to say, central Pennsylvania. And she was saying her payroll every 2 weeks is like $175,000. So, not a tiny amount of money.
Yeah, that's no joke. I mean, that's real. That's real.
$80,000 vaccine bill, stuff like that comes up for those family providers. So I get it. They need money.
Yeah. You know what I love about this whole antitrust thing with Change Healthcare is like, you guys, do you know how long Change Healthcare has owned the market?
For like 70 years? I like a lot of years.
Like, years. I love that like shit got fucked up and now we're like, antitrust. And it's like, actually, it's been this way for a long time. That's fine.
Well, this is
that's fine. That's okay. Anyway, all right.
But what we've been talking about is that like it took so freaking long for anyone in mainstream media to cover the story because it took them that long to like figure out how to talk about it in a way that anyone could understand or like the average business reader can understand. That's a huge problem.
Agree.
The media is like gutted in this area. There's so many stories like this.
Yeah. Strong agree. This is sad for America. All right.
We
Oh
are
yeah,
not
this
media.
was fun. Yeah, but
Oh
by the
yeah,
way,
this was
we're
great.
not real
Yeah, we're
media.
fake.
I don't know. We're
Oh
like
my
the not. Oh, wait, I'm not even gonna say it. We are anyway. So this was a thing. This is the information published this, and I do not have access to the full article, so I had to read many tweets about it. But
This is
basically,
how
this is
media gets paid.
this.
Pricey subscriptions. It's good.
That's
Good.
right. So you all should be appreciative that while we don't always actually go live, we are free. But no, but this article basically said a lot of it is hype, and all of these vendors are finding that, oh, guess what? Like, no one actually is really buying big time AI stuff because no one really knows quite what to do with it yet. So, which I feel like we all kind of knew, except for all those people who send us hate mail on LinkedIn. But you know, those are mostly guys who then also ask me to have a Zoom meeting, at 7:00 at night, which is weird. So,
No,
what are you gonna do?
no.
What are you gonna do?
Well, do you remember what
Anyway.
happened with Google's big generative AI relaunch with Gemini? They launched and then immediately had to like take everything down because it was saying weird stuff and creating weird images, right? It's not
Yeah.
straightforward or easy, you guys. We haven't like solved it yet. It's not actually ready for prime time. Not ready. Not ready.
Not ready,
Come
but
on.
I'm here for it. Oh my gosh. All right. Okay. Oh yeah. So no one can actually read this tweet, but we know what it says. So our friend Miki Tripathi wrote on the X. I don't remember. Oh yeah, it was X, not LinkedIn. That ONC is saving America with pushing through the HTI-2 rule ASAP. So any thoughts, Lisa? Anything we should be looking forward to that you've heard from the deep state?
Well, the one thing I actually don't know, I don't know the details on, and need to like double, triple check. As you recall, when an agency finalizes a rule or regulation close to the potential end of that administration, it can get a little tricky. So there is a
Yeah, like
timeline
with prior
here.
auth.
There is a timeline here. They need to get this wrapped up and out the door and finalized really, really quickly if they want to have any kind of hope of not having this pulled back if the Biden administration does not get another term. And the problem with that is that the industry does not love being forced to respond quickly to something and have no turnaround time. They're not a big fan of that. They do a lot of, interesting lobbying efforts to slow that down or stop it because rightfully they say we don't have time to actually like read through it, really think about the implications, give feedback, give technical advice and assistance. So the clock is on. And if there's one thing we know about Mickey and the ONC is that they are really interested in getting these rules done and out the door and closed off and moving on. So that it remains to be seen if this timeline is going to work for everybody who needs to give feedback on
it. Yeah.
TBD.
Yeah. TBD, but I do love the confidence and wanting to save America. So appreciate that messaging.
That's great.
This is a fun one. Okay, so no one can read this either, but basically our best friend Brendan Keeler, often wrong, never in doubt, basically all in the family here, said on the internet today that like, hey, wouldn't it be cool if we were like this guy, Rohit Chopra, who's in the banking industry, who said we should be able to use all kinds of different standards. And then Anish showed up, and I was like,
he's not in the banking industry. He's the director of the Consumer Financial Protection Bureau, which is an amazing small agency that was created in previous years by President Obama. And it was Elizabeth Warren's brainchild as well, that is actually doing cool things to protect consumers from like shady financial stuff.
Okay, so what I thought when I was reading Anish's response,
of course,
what I was thinking, I was thinking this is a very good response by Anish because I think Brendan was kind of saying Anish only loves fire, and Anish is saying no, I don't agree with like one standard. But what I was thinking when I was reading Anish's response is, God damn it, I need more blood relatives in positions of power. Like, what the hell? This guy's cousin?
Totally. Absolutely. Yeah, impressive.
My siblings, like I need come on, Kavolcha clan, like step it up. Anyway, but yeah, so we thought this was kind of like a fun thing, right? Because Anish is basically saying like, oh man, I actually think it's wrong that we're trying to use just one standard and like pumping stuff out. So God bless Anish Chopra. We hear he had like a pretty great fire thing at HIMSS that neither of us attended because we were doing stuff. But anyway, yeah, I don't know. Nice. This was great. God bless Brendan Keeler.
It was great.
Okay. All right, this is a pretty bad screenshot, but our friend Emily Peters of Uncommon Bold, their team put together a health versus HIMSS thing. I don't know. What do
Trend
you think?
analysis.
Health versus
Trend analysis.
what's
Yeah.
better? Which one's better is what I want to know.
Well, I think the thing that the piece from Uncommon Bold uncovered that I thought was really interesting was just how massive him still is. It obviously has so many decades of, experience and history in the market. It's just so much bigger. Even though I would say that Health and Vive really like punch above their weight or whatever in terms of their marketing, their communications, the stuff they put out into the world. But HIMSS is still so much bigger. It's just massive. And it's really hard to kind of, pull back from that. It'll be really hard for Health or for Vive to exceed their sort of general impressions, awareness, and things like that they do in the world. I was surprised, as I think you were as well, just how I think when HIMSS just sold off their conference business to Informa Markets, who's a for-profit company who's trying to actually, as far as I understand, turn a profit on the conference. Health, I think it's a little bit different, but certainly all these folks are in it for business reasons. But taking a nonprofit organization's conference and turning it into a for-profit enterprise, I think we're expecting to see more. Like HIMSS is like famously has like the worst food in the universe / no food.
Yeah.
In the past, they've had some big keynote speakers. I didn't see any really big keynote speakers this year. I was a little bit surprised about that. So things that would like attract people to come to the conference. I was a little confused about the trade show. It was certainly very big, but the attendees, it's very, very international. That is like the direction, as far as I can tell, that HIMSS is going. It's trying to be truly international, like healthcare, IT. That's what we do all the country.
Yeah, I'll say HIMSS was better than last year. But I still thought it was like kind of lower energy. It's like a different vibe, right? Like Health and Vive, they're the same, run by the same group. It's just, just like fun. Like there's high energy. There's lots of like exciting startups and I have to say, like HIMSS is so big that they're constrained to these really gigantic, kind of shitty convention centers. Like the Orlando Convention Center is objectively like the shittiest place on the planet. Like it is the worst.
I like it.
So it's kind of hard. So I don't know. I mean, I was only there. I actually did not go into the exhibit hall at all at HIMSS, Lisa. I didn't make it. I only did a little bit, but it's big. It's big. It's big and bad.
A lot of Civitas's members and partners are definitely still there. I mean, we spent some good time on the trade show floor, meeting with people and having those serendipitous meetings. They had a puppy park with real puppies, actual puppies, not just dogs. They were pretty cute. But yeah, the location's always going to be constrained, Orlando or Vegas. That's it.
Sometimes Chicago when we want to talk to the unions, Lisa. Anyway, here's Lisa speaking right here.
Absolutely.
I drew this heart around her in case no one could see her. But she's speaking about her favorite topic, interoperability. It was great, I heard, according to the internet, because as you know, I was in the air when you were speaking. But I heard it was the most amazing presentation at HIMSS. And next time they have you back, they're going to give you $100,000 honorarium to do the same speech again.
Yeah.
So that's what they told me, but we'll see what happens. Here's me. So we're leading into our we wish he was our blood relative. He's not, but Ritesh Patel is going to give us an overview of South by Southwest. Here I am speaking with three of my favorite people, Dr. Ben Zaniello, Dr. Casey Claiborne, and Dr. Darshak Sanghavi at Ritesh's event. It had a real name, but it's Ritesh's event. It was awesome. It was all day on Saturday. It was all healthcare all the time. There were amazing speakers, maternal health, cancer, all kinds of things. And it was totally fantastic and awesome. We had a real health panel.
In Austin.
Yeah, it was like totally cool. And Ritesh is a DJ, so then he did that.
Beautiful.
So here he is. This is him. You're about to see him. We did this amazing Photoshop of Ritesh, and now you have him on the internet. Here he is. Welcome, Ritesh, most important man alive. What's going on?
I can't believe I actually made it on this show. Look at this.
You made it, Ritesh.
Gosh,
you made it.
I watch every Friday. I never get invited, and all of a sudden, here I am.
Oh my gosh! Listen, you can come on whenever you want. I don't know. There's lots of different ways to do it. People, so. Anyway, well, okay. So Ritesh, introduce yourself because I've told everyone you're my uncle, my blood relative, not my blood. No one even knows. So tell us who you are and what you're
Yeah,
kind.
you're now cousin Cat, so it's all good.
Amazing.
That's what I like to
Amazing.
hear.
And we'll add you to the Indian Desi CIO list, so you can be
Oh my
officially
gosh,
in the company of
Lisa.
powerful people, right? So just
Oh
pretend
my
you're the
God.
cousin. You'll be fine.
That's
Oh,
what I was talking about. We
You
were
better
talking about
ask me.
we heard there's a secret WhatsApp group.
there is a
And
secret
now,
WhatsApp
oh
group
my
with
God.
143 CIOs. So what do? I hang out with Kat. I do whatever Kat tells me to do.
That's
So she
right.
said I should show up in Austin, and there I was at South by Southwest. So I work. I lead the digital health practice at Fin, and I focus on everything related to digital health. I have a very narrow view. If it moves, digitize it. So that's as far as I go. That's my motto in life.
Focus quite a bit on rural health, which is kind of how we originally got acquainted, right? I mean, no one actually
Yeah.
knows how we originally got acquainted, but
Yeah,
I
Natanya
don't
put us
know.
together when we talked about rural health as a passion of mine, to try and fix the delivery of care to those people who need it the most, right? So we
Yeah,
got you involved then, I think, and that was a year ago. So,
yeah.
and
And
now
then
you're
we drank
family.
a lot of vodka
Yeah,
in
yeah,
Poland,
in
and
Warsaw, right?
that's what worked out.
With
Yeah,
pierogies.
yeah. And
With
Lisa,
pierogies.
Lisa by default, because she's also
Yeah,
one of my blood relatives. So
yeah.
you guys are
Yeah,
everybody's friends now. Okay,
it's fine.
so it's actually not true. I did not tell Ritesh to go to Austin. He told me to go to Austin, so it's actually not true. But Ritesh, I know this is like your second or third time doing this event. So tell us what happened at South by Southwest.
Yeah,
What
sure.
happened?
So we usually do this on the day before everybody shows up for the big event. So usually it's on a Saturday or a Sunday, depending on the time. But last year we did it, and it was I think it was about half an hour south at a place called the Armadillo Den, where we took the whole thing over.
Mm,
Upstairs we had a conference. Downstairs there's a whole cool new outside stage, and then we did music at the end of the day with three bands that we've been working with for a while down there. Black Alak, Eric Tesmer, and Tamika. They're South Austin natives, and we like to put them on stage and showcase their talents. They're amazing, talented individuals. So that was the end of the show. So this year, well, the only thing was last year we had 200 people captive. Once they arrived, they couldn't leave, right? So there was a lot of complaining. I want to go see other things. And so this time we moved it closer to downtown, to see if that helps, which means you have to pay the South by Southwest tax as well to use their name. So, but it was great.
really?
Yeah, did you not
Wow.
know? Yeah, they charge you a
I mean,
tax
I
to
guess
use
I'm not
their name.
surprised.
Yeah,
I
that's why you
assume
get
that
a
they
lot of
are pretty controlling.
yeah, that's why you get a lot of people don't using their logo, right? Or using anything related to
Mm,
South by in any of their materials, right? We got away with it last year because we were half an hour south. Nobody knew we were there except for the health nerds who wanted to get
nice.
together. Right? So yeah, so same thing this year. We last year we launched Walgreens Clinical, the clinical trial business. Stefan Konya is a great partner. So he brought a bunch of the feds together, as I call them. They arrived en masse, ARPA, BARDA, the VA, all of those guys. And so we did part two this year. And thanks, Kat, for coming, and Lisa for joining us as well. Uh, well, here was the thing, completely by accident, but by design in a way from a theme perspective. Most of the morning was all female. All the panelists were female.
Yeah,
Was that amazing?
it was
Finally.
awesome. Like I think it was like 3 panels in before a dude showed up. It was pretty
Exactly.
cool.
That's
Exactly. And that
great.
dude
Yeah,
was
it
me
was
doing the interviewing, right? uh,
yeah.
yeah, it was great. So, launched GE Healthcare Foundation. I don't know, were you there in the morning when Savvy kicked off with the BioAstra NASA stuff?
Yeah, that was awesome.
I
Very
couldn't
cool.
believe it, right? I didn't know all that
Very
stuff was
cool.
happening with healthcare and space and NASA and all of those things. And then the afternoon, the all panel was amazing, Kat. We had a great panel by
I
Gloria.
know.
Yeah, expected. The bar was high. So,
Yeah.
and then the next day we did the part two of the music down at the Armadillo Den. So you had left by then,
Mm,
unfortunately. You had to go to
very
that
sad.
bigger, important thing called HIMSS.
I know.
Yeah.
It's
I
basically
mean,
the worst idea we've had is leaving early. But so what?
oh
So you
gosh.
actually stayed for several days doing real
Yeah.
things.
Yeah. Yeah.
And so what happened? Because the only other person I know that stayed as long as you is Natanya, and Natanya ended up somewhere weird, and
Yes.
no one knows. So what? So tell us like what actually like was it? Did we miss anything really awesome
Yeah, normally I don't buy a
other than
bag,
your
so
DJ stuff?
yeah, I
Yeah.
DJed the next day at the Armadillo Den before we got all the people going. But I would say there was a lack of big corporate stuff going on. There was lots of little conversations. The buzz wasn't there like it
Mm.
usually is, like last year. But I met this company from Germany called FAQU, FAQYOU. They are a Gen Z healthcare company, and they
Okay,
basically
okay.
aim all of their content to Gen Z on two categories: mental health and sexual health.
Ooh,
There are some very risque YouTube and Instagram and TikTok videos that they produce. They produce everything. They are Gen Z themselves, young kids, two of them flew over. So they want to come to the US. That was quite interesting. And then I met a guy who is an amazing filmmaker, very big in Hollywood, quit all of that and is starting a startup for mental health for Latino Gen Z called Menti, Mente. So spent an hour and a half with him on the lawn of the Four Seasons talking about what he's trying to do. So it was good to meet these innovators who are outside of the industry using their film storytelling
really
platform
interesting.
to do healthcare engagement and education for the generation that lives on their phones, right?
Well, so on that note,
Hmm.
just back to your event, right? One of the I love that the women's health panel was really good because they were people who seem to be doing actually really interesting things, right? I mentioned at the event that I feel like the previous decade or so of like femtech was really annoying to me. I didn't
Yeah,
find them to be, generally, as like a general kind of rude statement, I found it to be a little bit offensive and annoying. And this generation, sort of moving forward, of founders are doing really cool, interesting things that are not just all about necessarily about maternity or whatever. They're broader or they're specific things. And I loved it
Yeah.
was Jennifer Newell of Betty's Co.
yeah,
Such a cool person,
Betty's was
such a
good.
cool company.
Mm.
Shout out, like really interesting starting in San Antonio, doing really specifically and explicitly saying we are going to provide healthcare for Gen Z women where they are, especially if they're in states or regions that might not be very friendly to getting appropriate information, education, contraception, whatever people need, and just really meeting people where they are, meeting Gen Z women where they are.
yeah.
And just a really super compelling speaker, like really impressive person, interesting idea. So I love
Yeah.
that, and I love the fact you don't know Ritesh, but this is perfect because I, unfortunately for myself, speak German, and so I'm reading this and laughing to myself now.
There
She's
you
also
go,
married
right?
to a German.
And I'm married
Yeah.
to a German. I'll send this
Yeah.
to him in a minute. Be like,
Oh
look,
well, I didn't know that, but now I do. And
It's all working out.
I agree with you. That female panel on those three female startups and what
so
they're
good,
doing,
so good.
all three of them. Gabby was just amazing as well. But I do agree. Betsy's is just incredible what she's doing, and starting in Texas of all places, right?
But she,
Doing
but she said,
Right.
she's like, women here, young women here need advice, they need help, they need access, and we have to be where they are intentionally.
yeah.
And, just really like there is a space, there is a gap of
Yeah.
access to these services, and that's where we should be. Really
And
cool.
kudos to Wellstar for finding them and funding them and mentoring them and
Yeah.
Totally.
No, I
right.
was gonna say that was the Catalyst by Wellstar. Those
Mhm.
were their portfolio
That was
companies,
their
right?
portfolio
Yep.
companies, all three of them. Yeah. Yeah.
Ah, it's so
And
cool.
Really
That's
neat.
so
also,
amazing.
and what Ash is doing in Kenya with the Luala Foundation, right? Goes from Nashville to Kenya every couple of months to do this. And that town on the edge of Lake Victoria, I mean, it's just incredible to be able to do that because it's hard to get to. It's really difficult to get to
Yeah.
that. So for her to
Mm.
Yeah.
do that is just mind blowing. So I agree with you. The femtech stuff, this stuff is making a difference in people's lives, right?
Yeah,
Much.
I agree. I agree with you, Lisa. I think, I think that's probably like a lot of things. Like when something busts out on the scene, like sometimes it's like a little abrasive, right? And I feel the same way. Like I feel like femtech and like a few years ago was just like, how cool is your
Make it
vibrator,
pink.
right? And it was
Make the
like,
Make it
technology
it
pink.
was
pink.
like,
Make it pink.
Jesus
Make it
fucking
pink.
Christ. Like, like I can, the vibrators have been around a long time. Like, is that really femtech? And like, and now thank God, like things have kind of like merged along a little bit and there's
Yeah.
like more real stuff. And I actually feel like that initial messaging that came out, like actually alienated more people than
Yeah.
it helped.
I
So
agree.
yeah,
I
but
agree.
yeah, no,
Same.
but back to the, back to the point. Like those panels were actually
And those
really
companies
awesome.
are
I don't often
fundraising.
pay attention. Oh
Yeah.
yeah. And they all need
They're all
money. So
fundraising. They all need money and they don't need that much money, right? They're
No.
in relatively early stages. I think
Yeah.
Gabby's is a little bit further along, but the other ones are it's
yeah,
not a lot of money that they need. They're not running like hugely fluffy, like spend as much money as you can businesses, right?
yeah.
They're in this current, era of startups who are trying to be really efficient with their capital. They're not, these women are not out there throwing ragers or whatever. They don't have the beer on
That's
tap or
me.
whatever people did. They
That's
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 actually
me.
Cat. But they need
Yeah.
money, they need support, they
I
need
don't need any
real
money.
funding, and they're amazing. Yeah, she's good. Betty's is raising, like $1.5 million, and they already have most of that committed. So it's not that much money to really support a legitimately great idea and a really solid founder in the space.
And make a
Yeah.
difference in the world, right? I mean, they are. It's not technology that they're deploying. They're actually seeing humans and helping those humans face to face, right? It's
Right.
fantastic.
Hmm.
Says the digital guy who says
Yeah.
me, but also big
I'm
shout to
sure there's
Kat.
some tech.
Kat, you got a hand, for your cancer moonshots. Work
Oh
that you're
yeah,
doing. Remember
Stefan. I'll tell
those?
you what.
Yeah,
That guy, he is working it, and I appreciate
exactly,
that.
exactly. Uh, and then obviously our
Yeah.
friend Grace. Grace, that was again another powerful speech at the end of the day. All about the patient, just to remind us, right? It's all about the humans at the end of the
Yeah.
day. So that was quite good.
That was a great way to close it. I
Yeah,
thought. I think. Well, Grace is so fantastic, right? And
yeah.
I don't know if everybody actually knows because you have to like really love LinkedIn, but Grace is now the patient in residence at for CancerX.
Cataracts, yep.
So in addition
Yep.
to her amazing advocacy work, she now actually is like that's officially her role there. So it's really really
Mhm.
cool. She's always bringing it. Right now, she is on like her own non-alcohol rager on the internet about patients being involved in AI, which
Oh,
I think is totally valid and awesome. You've probably seen some of that.
saw the
Totally
post.
agree.
Yeah,
I
that's
think,
nice.
yeah. So she's follow her stuff. Follow
We
Grace.
did
God bless
avoid
Grace.
generative AI completely, which was good. We didn't talk about it at all. So, Lisa, do you think we'll need standards if generative AI can look at structured and unstructured data? Why do we need a standard? Is that what Anish Chopra
I'm
is trying to
actually
say?
I guess so. I mean, I struggle with his perspective there because he has been so focused on, driving people to do trials
Yep,
of bulk fire, which obviously is,
yep,
standard. And
yep.
so I agree with what he said in that post because I do think that implementation, what actually happens in communities, really matters. I
Mm.
do think we're a long way off from AI being able to leapfrog over all kinds of messy data. It takes a lot of work. It's not
Yep,
easy.
yep.
Maybe someday, but I'm just not I'm not a standard zealot because I think implementation matters more. Just like
I
Anish
think
in his new post.
it's data
Anish, me
quality, I
and Anish
think.
are the
Yeah,
same
there you
now.
go.
We
Exactly.
agree.
Exactly. Wow, look at
Amazing.
that.
Yeah. What?
Let me
Tell you
text
what.
him. I'll text him right now and tell him that you
Yeah.
agree
Oh,
with
is
me.
he is he in the
What up,
secret
Anish?
WhatsApp group? Yeah.
Yeah,
Tell him we're talking about him right now, and that
he's in
we're
the
Oh,
coming
secret
for
group.
his WhatsApp group. We're coming for it. Yeah, it's funny too. While you're texting him, Ritesh, is that on my panel, my last question, I actually thought was just a joke. Like I was like, let's talk about hey, AI is going to save rural America, and
and then
my
they
I
answered
shouldn't say
you.
stupid. I shouldn't say stupid panelists because they're actually quite smart, but my smart panelists actually gave legitimate
They did.
answers.
I was
They
amazed.
did.
I was cracking myself up. Like I blew out people's eardrums. I was cracking myself up so much. And they were like, actually, no, it might. That was awesome.
It's a
Oh my
lot of
God.
hype. Yeah, we. I think overall, it's starting to become now. Most of it is being applied operationally, operation efficiency. Summarize a chart note for a doctor, those kinds of things. I see it in clinical trials, where they're using it to generate summaries of a clinical trial protocol to make it easier to digest for the the PI at the academic center, things like that. I think that's where it's going. It's doing really well, but it's not going to cure cancer anytime soon, which what everybody keeps saying it will. So unless Cat's got a secret weapon somewhere hidden in a drawer, so.
I mean, we don't know what's going to happen at these parties I throw. Like, all kinds of things happen. People come up with stuff, and I don't know. But Ritesh, we really missed you at the party. Shuchi was there.
Yeah, I saw the pictures. I was very jelly. I was jelly.
Oh my God, we all looked so good. Okay, hey, one more big thing from you, Ritesh, and then we have to talk about pain and all kinds of things, and the FDA and clearance. So, in terms of like, you met some cool companies, you had some cool conversations. Like, what was other than, maybe it was AI, but like, what was like the biggest like tech takeaway from your time in Austin?
The biggest, I would say, the days of a big thing being launched in South by have gone. That buzz is gone. Like, Twitter, if you remember that, Meerkat, if you remember that, or whatever peer thing it was, and that sort of thing. But there was no sort of any, just before the pandemic, it was all AR, VR. Everywhere you went, everyone was wearing these VR glasses and AR glasses, and but nothing came out this year. There was nothing big. The only thing I saw everybody wandering around was on the sports side, sports tech, things like tracking athletes' sleep and, tracking how athletes are running around the pitch or doing all that sort of stuff. Huge amount of sports tech everywhere I went, in different locations, exhibits, right? Houses, that sort of stuff. So sports tech seems to be the big thing this year. But again, not as big as days gone by, like AR, VR, Twitter, those kinds of things. That buzz wasn't there this year at all. But if there was one standout, it would be sports tech. And, the whole athlete, right? Track wearables, connected shoes, connected shirts with sensors, sleep tracking, feeding, diet, all of those things. There were all sorts of things going about how technology can help the athlete, which will be fascinating.
Yeah,
cool.
I spoke at South by Southwest in 2016 about health data APIs, actually, back in the day now, 150 years ago, I want to say.
Wow. Tell Brendan Keeler.
I think Josh Mandel was on my panel. It was a bunch
Amazing.
of Harvard bros. So, and it was very much I agree with you. The vibe is obviously completely different now, but at that time there was a real moment of this is where the exciting stuff is.
That's the reason we did the house. I do the house to say to people, look, don't go for the panel pickers. Nobody's going to pay attention. Come and hang out with all the health nerds all in one place, right?
Here we are.
Yeah.
We were all there.
Here we are.
Eating tacos. All right, Ritesh. It was the best of times. It was the weirdest of times.
Thank you.
We'll see you later.
We'll keep going.
Thanks for having us, Ritesh.
All right.
All right, Ritesh. Welcome, Dr. Amy Baxter of Pain Care Labs.
Oh, you're muted, Amy. We made you mute, and now we got you to unmute yourself.
And now,
protection, because I was on the sidelines wanting to chime in like 8 times, and if I hadn't been muted, I'd have been derailing everything. So
that's okay. Well, this same personality is what attracted us to you while we were waiting for our wine in our little plastic glasses at the SBB event at JPM.
That's right. And the fact that the personality was still shining through while waiting for the plastic glasses really does say a lot. So
yeah. Well, here you are.
Yeah, well, so I got to hit up the South by comment. I think that it's changed some because now all the panels aren't curated, they're applied for. So people are pitching their panels, which means that there's a little bit of secondary gain. And so it may be that they're just, they're a little bit less spicy because they're a little more constrained.
Mm-hmm. Yeah, that's true.
I don't know.
Yeah.
But my other thing that I got to back is everybody's talking about what their better vibrator is. Dude, do not denigrate the vibrator. Vibrating and vibrate to Nikola Tesla. If you understand energy, frequency, and vibration, you have the secrets of the universe. So
perfect.
Respect the vibration.
No integration, but you don't need a tech startup to, I mean, maybe you do. I actually know someone who has an amazing startup in that space, but just making everything pink and calling it femtech makes me want to jump out of this window right here. I am over it. And I want some more important work to be done in the space. That's my only complaint.
Yeah, listen,
You know what I
entrepreneurs.
do?
I am not saying that you shouldn't keep making better vibrators. I'm just saying let's not make
Please
the
do.
entire category of femtech actually some pink version of sex tech. Like, I'm
Yeah, yeah.
confused.
Yeah.
Anyway.
Yeah.
Is because I mean, my company is a mechanical stimulator company, and the reason that we have, I think, in part had a hard time getting coverage from CMS despite reducing opioids is because everybody thinks vibrator and they immediately go to for her pleasure or his, or just femtech, dude tech,
Or anyone's.
sex tech,
All the things. Yeah, so Amy, with this great intro, would you like to give us your official intro so that our fearless watchers and loyal fans know that you're not making vibrators?
So I am making vibrators, and no. So I'm a pediatric emergency doctor, and I discovered a frequency of mechanical stimulation, which in the last 10 years we're trying to figure out in the field what to call it. And I think local vibration is probably where it's going to settle. But instead of electrical stimulators that are trying to trigger nerves to block pain and do stuff, we're using mechanical stimulation, and it turns out it does a lot more stuff in the realms of pain management and blood flow. And so what that happened this week that I think is worth talking about, because it's also a woman and tech. So on Wednesday, a New York jury convicted the CEO of StimWave, who is a female, of fraud.
Ooh.
And they convict, and women get about 60% worse sentences than men, just across the board, because we're supposed to be moral. And
True.
so if it's wrong, people are like, oh, that must be really wrong. They go away for a long time. So Laura Perryman did what we were recommended to do after the second or third time CMS would not give us a new code. And so there are a whole bunch of existing codes that you make a device and you use that code to bill for it. And you have to go to a certain group and say, we're like that. We're doing the same thing. And then they say, okay, fine. Then you can bill using that code. So anyway, if you're doing something that's really novel, there's no code for you. It doesn't exist. And so what she got convicted of is taking electrical stimulation for pain and adding something so that it would qualify for a more expensive code. And people told us to do that. So we make devices for low back pain, for post-op. We started with needle pain for vaccination, but we moved to post-op, and we're FDA cleared for physical therapy pain and decreasing opioids after surgery pain. Anyhow, but it won't be paid for unless it gets a code. So anyway, so that was the thing I thought was a really interesting set of hot takes, that and the fact that the director of AdvaMed came out in an article saying basically we were promised jetpacks. I mean, we were told if we got a breakthrough device that it would be covered, it would get a code, and it would be paid for, and none of that has happened. So I don't know how you can do it without doing fraud. I feel for the woman. Like, it seems like the system's broken.
So this is actually guidance you received. You said from the feds.
No, so consultants. So the $1,000 to $1,500 an hour industry that has proliferated in the shadow of this lack of coverage. So in order to do this, so NIH is totally clean. They're fantastic. They really are advocating for getting new interventions out. And their bold plan for 2025 was that half of pain management would be handled with devices instead of therapeutics. So that was their bold plan. So they funded me and a bunch of other people to help end addiction long term, because pills are the problem. Pills for pain are why we have an opioid crisis. And then the FDA has cleared a lot of these devices, said, yes, I've looked at the research. Yes, it works. You can do this. And it doesn't matter. If it doesn't get paid for, patients can't get it.
Yeah, and like you just said, there's a cottage industry and beyond of people who are trying to help health tech, med tech startups get reimbursement in various ways. And of course, it's also such a hotbed of fraud, waste, and abuse. And finding that sort of, middle ground and getting these things funded, and then also being like, in this case, right, you said, hey, we have this massive opioid use crisis in the country. There's got to be other ways. We know that there are other ways we can manage pain. Where is that middle ground of trying to help these things get approved and get paid for?
Yeah,
I
so
don't know.
there's a bunch of really cool, deep, embedded history in this. So 1882, the codes that CMS works on now, so Centers for Medicaid, Medicare, the codes they work on say that they're supposed to cover illness, injury, and bodily malformation. And the subsequent bits of that, like Code 6 of the Social Security Code, says you're supposed to pay for pain but not comfort. And to quote an orthopedist that I was speaking to yesterday, he said CMS is comfortable with the fraud they know. And so the fraud that happens is that CMS pays for pain pills and they pay for bracing and immobilization. But what we know now is that pain is actually treated with options. You can't, it's your primary biologic evolutionary survival system. You can't shut it down with a pill because that's how you evolve and adapt and don't die. But movement actually stops pain, and immobilization makes it worse, but they will pay. So this is what we get advised. So they'll pay $1,200 for a brace that costs $38 to make for low back pain surgery. And it turns out very few, like maybe 10% of surgeries actually need a brace after you have them. So we make a low back pain device that uses different harmonic vibration interactions. But the point is, what we were told was you can qualify for the code that will reimburse $1,200 if you just add 2 little slats to it. And so that's what this woman must have gotten advised to do was, look, you'll fit the definition of this thing that's already got a code. You're doing something new. You're never going to get paid for something novel, new, innovative. So it just shuts down innovation, and it does tend to elevate fraud, right?
Wow. So do you agree with this person being sentenced? Or is it just, are you just like, holy shit, that could have been any of us, given how the advice goes in the market?
I didn't do it because I don't think it's ethical, but part of it is because I'm annoyed at the system and I want to fix the system rather than getting a code, honestly. I'd much rather come on your show and trash my chances of getting a code, but make people aware that there's this huge amount of fraud that you've got orthopedists who will bill for the $1,200 and then they end up buying them at $300 and they charge rent for the devices that are in their offices. And that trickles down to orthopedists want $500,000 to do a study on a device. Whereas if it's a vibrator for needle pain, there's like 100 studies that people did for free for that. So that trickle down of paying for immobilization and bodily malformation, that has repercussions.
Yeah, that's wild. There's just so many things like this that are just barriers to, I understand, right, that you want to have things that are safe and effective for the great American public. I'm not currently right now going to start trashing Ozempic.
No, FDA does a great job of it. FDA does a wonderful job of making sure they're safe and effective, but it's irrelevant if doctors aren't going to write for something their patients can't buy or can't afford,
right,
or isn't covered. And so, and insurance companies take their cue from CMS. So
from CMS.
Yeah, but one of the
yeah.
I got more dirt.
Yeah. So listen, I love dirt, so in terms of this faster pathway, like what are the odds that it's going to happen? Because it sounds like it's been something that people have been calling for a long time.
Well, there's 3 different potential solutions here. So one of them is called the No Pain Act, and that was passed at the end of 2022 as part of the omnibus spending bill. And the idea there is if something has been proven to reduce opioid use after surgery, then pay for it. And so, and then it's not willy-nilly. That's, I think because CMS is used to the fraud they're familiar with, they don't want to open the floodgates to more fraud. And, as soon as you let them pay for scooters, all of a sudden you've got 18 scooter companies saying, hey, you get my Cadillac scooter. It's paid for by Medicaid. So I get that issue. So the problem is it was supposed to come into effect this year, and then they kicked it down the road to next year. And the regime could change, and then the paying for tramadol instead of actually paying for cold therapy or other devices that have been shown to reduce opioids.
Right.
That's an issue. But that's a possibility. So that's one mechanism that could help pay for some of these things. Second thing that is a possible support or solution is something that they've had that certainly the breakthrough, there is something that's been initiated that is if you're a breakthrough device and if you are approved by the FDA, and if you meet with the FDA and CMS beforehand, then they can say, okay, yeah, we will pay for this. And so this is called the Transitional Coverage for Emerging Technologies. And it could work. The biggest thing, and I've talked to the CMS ombudsman ad nauseum, the biggest thing is getting CMS to meet with you. Because they previously, so the third thing is they had something called the parallel review. And after our like $60 devices that reduced opioids after ACL reconstruction got turned down because they were for comfort, not pain, it's like, okay, fine, let's do a parallel review for the low back pain thing. And let's not worry about pain, let's worry about opioid use. And so FDA met with them, and CMS wouldn't meet. And I've got 3 pages in tiny print of all the times I wrote them saying, I want to meet about a parallel review for the new device. And they're like, well, we only do it for national emergency. And I said, well, it's NIH funded for opioid use, and that's a national emergency. And they're like, oh, well, we don't actually have staff right now for that. And I've got all these emails, just pages and pages of not it's. So the transitional coverage for emerging technologies could work. There certainly, if no pain gets implemented, that will probably solve it all. But the biggest issue with transitional coverage for emerging technologies, in addition to having to meet with CMS, is that it's for expensive ones. So there's no place for lower cost ones to get approved, since parallel seems to be mythical.
That's an interesting point that I've definitely heard before, right? Like lower cost solutions, technologies, even drugs, are not necessarily getting the same priority around commercialization because they just don't make as much money for as many people, as many corporations. Yeah. And, not to put my tinfoil hat on here, but, I think that sometimes can be an issue. And, understanding how commercialization money works in healthcare is a big deal. I do, well, I have no idea. Obviously, we've reached out so many times to CMS, like what's going on there. But at the same time, the no staff is a real issue, right? I think having staff who have expertise in these, it's really hard. I mean, you can find out how much people at CMS earn. It's the same as other federal employees. Not very much money. If you are a true expert in the space, like probably not going to work there. So that's a tough one. I don't know the solution to that. That's a really difficult one for sure. Everyone can submit a request to speak to CMS and to every government agency, and they should be responding to you. They should.
Yeah.
They totally should.
Yeah, but they don't. And one of the things that does end up causing is that the holding out for the payoff of consulting later or blocking things. So I have heard of a number of people who are waiting for their lobbying job afterwards. And, if you cut that off, then you're going to have even fewer people who want to work there. But it's they're really hamstrung by having responsibility for all of these things, but not authority. But here's one number. So the drug Eliquis that is for thinning blood for people with atrial flutter, that is the single most expensive drug that CMS pays for. It is $13.6 billion a year. You could pay for a $65 device for a total knee replacement for every single person who gets a TKA in the country to reduce opioids. You could do that for 1/1000th of what is spent on Eliquis.
Wow.
And Eliquis is a $5 warfarin drug. It's just that, if you've got a tiny percent of higher risk, then why is a doctor going to write for something with a slight bit higher risk? Because there's no incentive for the doctor to not have insurance pay $13,000 a year.
It's wild. I was actually thinking when you were saying, "Oh, they're not responding. They're not," or they're saying they're just kind of saying not right now or whatever. It's like, yeah, other big bad companies would just make their lobbyists get that meeting.
Yeah, but
Totally. Which is not,
and that's a bummer.
way of things getting done.
It is terrible.
It really sucks. I understand it. I'm adjacent to that world, but it's also just a real bummer that like a better idea that isn't expensive and is a non-opioid solution is not getting attention, right? It's time.
Yeah, and it's not just one. I mean, I think this is one of the things. My son says that people will tolerate a degree of inevitable evil. And I think that we've all gotten used to tolerating some inevitable evil, but in this situation, greed equals death, because the number of people dying from opioids every year, which is 100,000-ish,
pretty damn high.
It's a lot lower than the number of new opioid use disorder patients. And that's 3 million a year. And so where do these 3 million a year get their pills? It is almost 1-to-1 for pills that are written for surgeries that are unnecessary. And if there was something else, then doctors wouldn't write for home opioid pills, because they really don't work so well, because your receptors have already involuted in 3 days. So it's, it's a little evil, and any one company can bitch about it and get their lobbyists, but it's a writ large. The whole reason we have the opioid crisis is because nobody can afford any other options. They're not out there. And so the only thing doctors can write for are the opioid pills that then don't get used and then go straight to the experimenters. And, some of them are the people who are, yeah.
Yeah, I mean, that's what's crazy. So we have the big issue here that breakthrough technologies like just aren't able to get their reimbursement codes right as quickly as they need to, or at all. But then separately, like your whole solution, reimbursement pathways. Yes, thank you, Lisa.
Whatever.
And then talking about like this obviously is a topic that I care about very much. I talk about it all the time, but like opioids, right? Lisa, what did Dershak say at the panel that we did about the number of Americans on chronic opioids?
He was talking about the letter from the Surgeon General of Vivek Murthy that was just asking people to not asking doctors to not write these massive prescriptions for whatever something minor. Please don't send your patients home with like a 3-week supply
60 days something like that,
whatever, something insane where you're like, what are you doing? It doesn't do anything besides get diverted. And the challenges there of not really getting the response that they had hoped for. And obviously, I mean, it is a big deal. Like every single medical doctor who was practicing got a letter from the Surgeon General, and it still didn't totally change the behavior, of course. I will say it is better. Like my big joke was like, I got a tooth removed and they sent me home with they gave me one Valium. My prescription was for one Valium, a single lonely old Valium. There was no way it could be diverted. I took it in the office. They watched me take it, right? So that was successful. It's not always been that way, right? And so, it's changing in part, but certainly people are still getting massive prescriptions they don't need. People are on long-term opioid prescriptions, like long-term significant amounts of opioids. That's crazy to me.
I don't care about that, because first of all, they're not diverting them. I mean, if you're on a long-term prescription for chronic pain, you're going to use it all, and it's not going to go anywhere.
You're counting it. You're like, you have to count it and make sure you have enough to get through the day.
Right. And so one beyond just diversion, really there's about an average of 6.5% of anybody who goes on any surgery who has continued opioid use 90 days later. And it's just genetic. It's about 15% of people are at risk of getting so much more reward from those pills that if they get more than a 3-day supply, their risk of continued use goes up. So, and the thing is, like, for your wisdom teeth or for your oral surgery, ibuprofen works better for most of those people. So,
totally.
So there's a couple things. I think we've been spending all our time on interoperability of opioid prescriptions and making sure we understand where everybody's getting them. But the chronic people aren't the problem. I mean, they don't. A lot of them actually don't end up getting opioid use disorder in terms of needing more and more and more. They're just maintained. That's fine. They can have hundreds of pills, but it's the new prescriptions that are written and the stuff that's in people's medicine cabinets, because it's like 66% of first-time opioid misusers are getting it from somebody's medicine cabinet.
Interesting.
Yeah.
Wow.
Yeah. Well, Amy, LinkedIn cuts us off pretty soon here, but what's your last hot take? And we'll have you on here to talk more about opioids, because everybody knows I like talking about that.
All right. Last hot take is it's Child Life Month. And this is the absolute longest anybody studies for the least pay and least respect in hospitals. So find somebody who does child life work and they understand how pain works. It is about decreasing fear, understanding and increasing options. And their profession is the path to solving the opioid crisis. That's my story.
Oh.
All right, child life professionals. I love that. Well done. Nicely done. Dr. Amy Baxter, medical doctor. All right.
Amy.
All right. Well, Lisa, here we are. I don't even know if we're still streaming. I'm not sure. But anyway, you're the best. I hope you sleep.
We need a long
weekend,
nap.
Lisa.
We need long naps. Long naps. See you later.
I hope you have a nice long sleep, but not too long.
Yeah.
All right. Goodbye to our
everyone.
loyal fans and our loyal followers. Goodbye, Melissa. Thank you, Amy, and thank you, Ritesh.
Soon.